patient shares his story as the medical community pieces together the puzzling COVID-19 related condition. WGN's Dina Baer has more.
We first heard about severe inflammatory symptoms linked to children and COVID-19 back in the spring. It was confusing, even for infectious disease experts. Now the medical community has a more clear picture of the rare but life-threatening condition.
My stomach started having sharp pain in it.
It was the end of July when Jalen Williams' mysterious symptoms came on quickly.
My energy was very low. I didn't want to do nothing. I didn't want to get out the bed. I just wanted to lay down and sleep all day.
The 13-year-old was hot to the touch and complaining of pain. His father immediately took him to a local hospital.
By the time we got to the hospital, they checked his temperature. He was 105.
It was really, really bad. I never had nothing like that.
After 2 days and no improvement, Jalen was transferred to Lurie Children's and brought to the pediatric intensive care unit.
When Jalen came in, he was actually very sick. When I first saw him, he was having very severe abdominal pain, very severe neck pain. It seemed that he did have an infection with the virus that causes COVID-19 several weeks before he came to our hospital.
It was a major clue in Jalen's mysterious symptoms, but like many children, he never showed signs of having COVID-19. Lab tests and infectious disease specialists determined the 13-year-old was suffering with MIS-C, multi-system inflammatory syndrome, a rare, exaggerated immune response that can occur in children several weeks after a COVID-19 infection.
Compared to the number of pediatric patients who get infected with COVID-19, a very small number will go on to get MIS-C.
Yeah, it shocked me too when I first heard that I had that.
MIS-C causes inflammation throughout the body and can lead to organ dysfunction and heart, kidney, and breathing problems. It's not yet known why some have gotten sick with MIS-C while others have not, or if children with certain health conditions are at higher risk.
We know that MIS-C is not contagious itself, and so a patient with MIS-C is not contagious. They're past that period.
You're a tough kid.
Doctors at Lurie administered IV steroids and a medication called IVIG to dampen Jalen's overreactive immune response.
I just felt real bad for him, just dealing with all that pain.
When I first read about MIS-C, it was difficult to believe that it was something that was occurring because it is a very strange presentation and children definitely have very severe symptoms, and so it was definitely hard to believe, and seeing is believing.
So far, doctors at Lurie Children's have cared for about a dozen children with MIS-C during the pandemic. According to new data just released by the Centers for Disease Control, there have been 792 confirmed cases and 16 deaths in the United States. The CDC is urging parents to watch for symptoms and seek medical care right away if a child has fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, or fatigue.
And that's why it is really important that to prevent the spread of COVID-19 from the start, because like you said, it is a very difficult condition to diagnose and treat, and so the most important thing we can do is prevent it.
After spending about a week in the hospital, Jalen has been building up his strength.
Keep an eye on your kids, even though you might think it's a little them complaining about the littlest pain. Just pay attention to it, because that mystery sneak up on you and have your child in a place where you do not want to see them at. And I pray for my son to come up out of that situation. Yes, it was very difficult.
It really hurt bad. It's pain that I never had before, and I don't want no other kids to have the pain.
Jalen's doctors expect a full recovery. His inflammation levels and heart function are all normal now, but they'll follow him long term with the hope to learn much more about MIS-C and any possible lasting effects.